Local government knows that there needs to be change and improvement. We're not averse to change. Things need to change. We have a huge crisis, as you've described, in social care. We have a workforce that's declining and need that's going up, and also a huge lack of investment in our social care. And that is the key issue. The key issue is the lack of investment to meet these needs of people across our local communities. The National Care Service involves huge structural change. It involves huge, expensive and structural change, which will take, at least the life of this parliament to develop, whereas people need change now. And local government's view, very strongly, is that that change could be delivered now. We don't need structural change to deliver it. We know there's need to be improvement. That improvement could be invested in now. We could look at the employment issues and support the workforce more now. That could be done. That could be done on a national basis as part of national care, but without needing the huge structural change that is being proposed by the government. It's also the whole premise of it is looking at care from a very narrow angle. Care in our communities involves far more than that 15-minute visit to somebody's house to give them that care. It involves the environment in which people live, whether our paths and our parks are accessible, whether people have got green out of open spaces they can get to easily and enjoy their life, whether they've got library services that can help them in their work, whether the local employability services are helping training up a workforce that can support people as well. There's a huge range. Now, housing itself, are our houses adapted to meet people's needs when they're living in their communities? There's a huge range of things needed if we are going to develop care to support people living in our communities. And the way the National Care Service consultation is looking at one aspect of that, it's not seeing the whole picture. It's not seeing what care actually means and how many of those services are actually local government delivered, and how much of it needs to be integrated, planned, made efficient, supported by others from the public sector as well, to deliver in our local areas services that really support people in those local areas.